What's up, y'all? This is WusuMD. I had a patient that had hip dysplasia that asked me, what can I do in order to strengthen the muscles that are going to make walking around easier? So here's the issue with hip dysplasia is when you have the acetabulum in your femur or the cup in the ball, your people with hip dysplasia have less coverage of the bone, and so their ball is further out, which means the muscles that are helping keep everything intact have to work harder. So for patients with hip dysplasia, we actually have you need to get stronger in your abductors or abductors, all these glute muscles that help keep you upright and basically help keep you balanced. And so we're going to work our glute max as well as our glute medius and glute minimus. So if you're looking up things for yourself, other things online, if you look up any glute activation exercise, that's a good place to start. Okay, so I'm gonna give you my favorite exercises that are gonna help strengthen and lengthen the glutes. We're gonna start with pigeon. I'm gonna show you two modifications for a pigeon pose. Let me start here. So again, when I'm doing this exercise, I am not just going into a stretch. Everything that we wanna be doing is we wanna strengthen as we lengthen. So I do this on a couch in which my foot is on the seat of the couch and my knee is on the armrest. That's because I have less flexibility and external rotation. I'm working on it. And so then I put my arms here. And what I'm going to do is I'm going to use my arms to help lower my body, hinging at the waist. And I'm feeling a stretch here. I'm putting more pressure into that hip and then coming up. Pressure into the hip as I come up and then come up. So eventually, my goal is to be able to do this without using my arms. And so you can start with one arm off. I'm basically trying to come down and up and using this muscle as I elongate that glute max and glute medius, as well as your piriformis musculature, my external rotator, in order to get that strong and long. The other variation is to do this, and if you need to, you can do it holding on to something, but do that same exercise. I'm basically gonna put my ankle across my knee, and I'm gonna do a squatting type motion. So with that squatting motion, I'm putting my weight back into my hip, just to see it from the side, up. I'm gonna squat down, I want to sit my hip back. I feel this loading, and then I use that musculature to push myself up. So this exercise is a good variation of that. And now, we're gonna come to another good activation. So from this position, I want you to turn your toe in, and I'm gonna drive my foot up to the back corner wall, and then up to the corner ceiling. And so from here, lift, squeeze up top, as far as you can go. Every time I return to the center, I'm thinking about keeping my toe pointed in. You do about 10 repetitions of that. And then you switch to, now I'm gonna go directly lateral. So same thing, toe pointed in, I'm gonna go lateral. This is another exercise you can actually do laying down, but sometimes we don't wanna be laying down in the middle of the day. So you can do this while you're at work and you can stand up. And finally, I get a stool or a table or a chair. You can do this also holding on to something for your balance, but I'm doing this step down motion. With the step down motion, I want to push my weight back into my hip and then come up. I actually tap my toe. The only reason I tap my toe is so that I don't use my ankle to push off on the bottom. So you basically go down to where you can. Every step is different, and then you're gonna come down and up. So you do this exercise. This is what is helping to stabilize your hip when you're walking and make sure those external rotators and the abductors are nice and good and strong, okay? Do those exercises and you will get better.